In order for a student to qualify for autism under Ed Code, basically it says ideally they would have shown deficits in the areas of nonverbal, verbal, and social communication prior to age 3. But if it's after age 3, they'll still take it, essentially. I mean, and that change kind of correlates with the DSM-5 change, where it changed from age 3 to like early childhood. But they do have to have deficits in those areas that are impacting their access to education within the school setting. So it's one thing to say, like, for example, my child struggles with reciprocal conversation, for example. That's a common one, right? Like they struggle, they'll, always bring the topic back to something preferred. Great, and that may be the case. And we're not saying that that's not, I'm just playing the devil's advocate here and speaking as though I'm the district. But at school, he's able to answer questions. He's able to engage in conversation with the teacher. When he's out at lunch and recess, we see him, playing on the playground, playing back and forth with friends. So it's not to say that the deficits aren't there, but are they impacting the student's ability to be successful within the school setting is what they're looking at. Of course, if there's very significant delays in the testing and the students, significantly behind in language, they're going to qualify because they need to build their vocabulary or they need to expand their sentences or what have you. But then there's a difference between qualifying under speech language impairment and autism. So autism, you have to have both the delays in communication, both verbal and nonverbal, the social communication component, and you have to exhibit some other characteristics typically seen in an individual with autism. And then there's a list in Ed Code, like, for example, restrictive and repetitive stereotype behaviors, rigidity. So it's interesting because it's kind of a subjective, I think, paragraph, and they're not allowed to diagnose, but it's pretty much saying like, you have to show symptoms that you would see in someone who's diagnosed with autism. But then the second prong, again, is even if all of these things are reflecting within the student, is it significant enough that it's impacting their ability to be successful at school? So if a student's sitting in class stimming, for example, but they're able to do all the work and they're socializing and they're having, positive interactions, they're not going to qualify.